Hello, everyone. My name is Christina Stapke. I'm an integrative and functional dietitian, and welcome to Practitioners in Quarantine, Why Mental Health and Digestive Health Matter During this Pandemic. So we're going to be doing a double interview, and I'll first be interviewing Roz Ando, who's a licensed mental health counselor, and then Roz will be we'll be switching roles, and then she'll be interviewing me. And each interview will be about 30 minutes or so. Awesome. And just before you get started, I would love to kind of see who is with us right now and like or comment just to kind of let us know you're tuning in. Yeah, and we'll be answering questions throughout as well. So feel free to go ahead and answer your questions. And then before we dive in, just wanted to give a little disclaimer that, all of this information here, everything we talk about is just designed for educational purposes only. And the content does not and is not intended to convey medical advice and does not constitute the practice of medicine and doesn't substitute, nor does it replace professional medical advice, diagnosis, or treatment. All right, so now that we've taken care of that formality, so I'd just kind of start off and I'd like to introduce Roz Ando. So again, like I said before, she is a licensed mental health counselor who has a practice in Wallingford in Seattle. And we met each other online through a practitioner Facebook group. And I wanted to interview Roz just because she does a good job of combining both Western psychology with Eastern mindfulness, as well as the mind-body connection. And especially right now, everyone can benefit from some kind of mental health support. And I find I always am recommending that for my patients. And she's just been a lovely person to work with for the short time that we've known each other so far. And I just would love for her to share her knowledge and expertise with us. And so you can all take away some practical tips from her as well. And I will note, partway through each interview, we will be giving some advice and practical tips on things that you all can take home today and start doing yourselves. So let's get started. So Roz, just tell us a little bit about your practice.
Yeah, thanks, Christina, and thank you for inviting me to do this and for the nice introduction. I have a mental health counseling practice in Wallingford, and although right now it's from my home, it's all online now because of the pandemic. And I do counseling for anxiety, social anxiety, depression, PTSD, also couples and families. And I call what I do, my laptop is sliding just a little, kind of a top-down and bottom-up approach. So, for example, let's say you came to me during the pandemic and you're having a lot of anxiety. We would, first of all, just talk about what's going on for you. Counseling with each individual is different, depending on what your goals are. So we talk about that. And then just, I would want to really hear your story. And then we would probably talk about some things that you could do to minimize that anxiety that you're feeling, kind of through the way you're thinking and what you're focusing on. So an example of that might be, let's say it's just the pandemic, the whole thing is just kind of invading your mind all day long. You're worried about your parents, worried about your kids, worried about your job. So it's just too much. So one little interesting technique that we use is, it's called worry time. I think that's what it's called. We'll call it worry time. And it's just kind of choosing a time. So let's say I'm going to spend 15 minutes from 4 to 4:15 every day, just worrying as much as I can. Just really getting down, thinking about all those worst case scenarios, writing it down. That can be really helpful too. And then I'm going to leave it. So every time I start to think about, oh no, what about, should I visit my parents? Are they going to be okay? I can tell myself, oh no, already did that. I got to wait till tomorrow. So it sounds funny, but it can actually be really helpful. And that's an example. That's definitely a top-down technique. So it's things that you're thinking, things that you're telling yourself to help reduce the anxiety. So we might also do like breathing techniques. Those can be great to help calm your nervous system, something like that. And those are all kind of top-down things. So the bottom-up side of it would be, so let's say you're also having, like you have this feeling in your solar plexus, like, oh, it's just really grabbing you. You feel like it's really tight there, something like that. And it's like, what the heck is this? You know, it feels like, you know, you feel kind of sad around that. And there's just this strong feeling that you're getting that seems maybe out of proportion to what's going on, or it doesn't quite make sense to you. So we would use more the bottom-up kind of technique, where we would really get into that thing that you're feeling, that sensation or that emotion, and go from there and see where that takes us. Maybe there's something about this thing that reminds you of something that happened when you were a little kid. You know, maybe a relative, somebody got really sick, and you didn't really even know that that was connected to what you're feeling. So, and working with that stuff can be really helpful at getting to kind of the root cause of that anxiety you're feeling that might seem a little out of proportion. So, yeah, that's an example of the work I do.
Yeah, I love, there's so much awesome stuff in what you just said there. I mean, first of all, I love how you describe the top down and the bottom up. And I love the idea of worry time, because it's not like we're going to stop worrying, you know?
Right.
And so allowing yourself that time and, you know, allotted time and finite time to do that and take care of it, I think is brilliant. I love that idea. And it's something that I definitely want to start using with my patients. I love, you know, writing things down, something I recommend. So yeah, that all sounds really awesome. And it seems like it would be relatively easy to apply to.
Yeah.
Incorporating into,
I have to say that that's not my original idea. So just to put that out there, I can't really take credit, and I really have no idea where it came from. So, but yeah,
it's awesome.
Yeah, thanks.
Yeah, that's great. So I know you, so in kind of talking to you and getting to know you, your focus has become chronic pain. What kind of led you to decide to focus on that?
Right. So that is really a separate, it's not really separate, because I see people also in my private practice who have chronic pain and are dealing with that. But I also have a project with a colleague, my lovely colleague, Holly Santos, and we are focused on bringing people techniques that they can use to work with their chronic pain to actually reduce or eliminate it. And that started, it really probably started like 25 years ago or something, when I really became interested in mind-body healing. You know, I'm kind of like a real nerd for that kind of stuff. I used to just read a ton of books about people who'd recovered from things like cancer and different things. When their doctors told them, well, that's it, you know, and they recover. So I just kind of have always been interested in that. And then about 3 years ago, almost now, Holly and I took a class with this Dr. Beth Darnell at Stanford. And it was about, she called it psychological approaches to chronic pain. And all about things that people can do themselves, a lot of it using their thoughts and what they focus on to actually, surprisingly, reduce or even eliminate chronic pain. And from there, we did like all the reading we could, took a lot of different classes, and it turns out there's just a ton of information out there about what people can do about their chronic pain. We have a guy here in Seattle, what's his name? Dr. Hanscom, who was at Swedish. He was a spinal surgeon at Swedish. And he ended up actually quitting his practice and teaching more of the kinds of techniques that we use, because he originally wanted to really make a difference in the world with his spinal surgery, you know, try to cure back pain, such a huge problem. And then he found that the surgeries that they were doing really were not very effective, and that through these other kinds of practices, his patients ended up often not even needing surgery. Once they did these practices, they were no longer in pain. So that was really cool. There's actually a really touching article that he wrote that's on link to it on the website mindinyourpain.com about why he quit his practice. And anyway, so learning about all that, Holly and I just were thinking, how can we not bring this to people now? You know, knowing this is out here, knowing chronic pain is such a huge problem. So we decided to develop these classes, which now are going to have to become a webinar about this stuff.
Yeah, so cool. I'm just, forgive me, I'm putting this in the comments if any of you are curious about this. So mindinyourpain.com. Awesome.
Okay, thank you for doing that.
Yeah, what a cool field. I mean, it sounds like you've been invested in this for a long time, and you know, it can really, really help people. So that's awesome. Yeah, thanks for sharing. So yeah, I'm curious, through your work, seeing clients and your study of chronic pain, what have you noticed people just really struggle with the most?
Yeah, probably a couple of different things, but I think the number one thing is probably just losing hope. You know, so people go to different doctors, they try to find the answer, they get an MRI. There's this really interesting, there now are several studies about people with MRIs who are in back pain and not in pain. And it turns out they look the same. So
interesting.
Yeah, people over 40, probably not you, Christina, but a lot of us have what's called one of the doctors that we've studied, Dr. Schechter, calls it the gray hair of the spine. And that's disc degeneration, disc bulges, like everybody's got that stuff. And so people who are in pain and people who are not in pain, they look basically the same usually. So why is it, right, that some people are in pain, some people are not? And so people lose hope. Like, well, maybe there's nothing I can do. You know, this doctor has told me, you know, maybe there's something there, but it's not enough to be causing your pain. And the next doctor says, we can't find anything. So I think it's really hard. And they're looking for a structural cause. So that's one thing. And then they're losing hope. And there really is so much you can do. So don't lose hope. You know, lots you can do.
Yeah. And I think all of you tuning in, I mean, may be curious about, you know, how the pandemic and how the, you know, chronic pain and the two are connected. And we know Roz will tell us that, you know, stress can actually potentially worsen that. So I would love to kind of learn more about that in a little bit. So yeah, I mean, it's so interesting to me, the two MRIs looking totally the same. So really, you know, having to do with those pathways that I'm sure you're going to talk about in a minute. But what do you think the biggest misconceptions are? You kind of touched on this a little bit earlier.
Yeah, I think probably that there has to be a structural cause for chronic pain. Because often it starts out as a structural thing, but then, you know, within 6 months or so, probably should have healed, unless it's some, you know, like bone on bone arthritis, like a really, like I think about my dad in his 80s, you know, with his old joints because he's been very active. Well, that's probably not going to go away. But short of that, most pain will resolve or really kind of should resolve. And so then sometimes it doesn't. And why is that? Well, it's not necessarily structural. And I think there is a big misconception out there. It's like, we just need to do the right imaging. We need to find the right drug. We need to have the right kind of surgery. But it turns out that it often can be a problem with brain wiring and your brain actually learning to sense that pain. And something like we're going through right now, the pandemic here, there might be, well, I don't want to jinx it. Right? It's like, oh, you might develop chronic pain. No. But stress definitely, like being flooded with stress hormones, I think we all know that's not generally healthy, right? Like, stress is not good for you. But there really is anxiety, anger, those kinds of emotions really are associated with this kind of inflammatory chemistry. So that combined with the brain wiring thing, that's often really more at the root of the pain than even the structural cause that it started with.
Yeah, that's so interesting. So there's a lot more to it than just something, directly, or at least physical, that we can see in our bodies. It has a lot more to do with, the chemistry behind it. Yeah, that's so interesting and awesome. So what do you say to people who are in pain right now, who think that you're, maybe saying that their pain is all in their heads?
Yes, that's exactly what I'm saying. because that's where all pain is. So it doesn't matter if you're, a football player who breaks an ankle on the field. The ankle sends a signal up to your brain, and that's where you perceive the pain is in your brain. So no matter what kind of pain you have, it is in your brain. And that broken ankle, that's acute pain. So that's, pain that's officially, I think it's like less than 3 months, less than 6 months. It depends on what definition you look at. But that's acute pain. So then that should heal eventually, right? But sometimes it doesn't. Like we were talking about, it'll cause your brain to keep sensing that pain. So the stress of that injury, and maybe added with the emotions involved in maybe not getting to play football anymore. Maybe you're done. Maybe you're a senior in high school and that's it. Although right now that takes on a whole different, whole different connotations there. But if you're also really sad, really stressed out about that, you become hopeless, then that causes that inflammatory kind of chemistry in your body, which is going to exacerbate that pain and also help the brain to wire to pay attention to the pain. So is that, I mean, it's probably not crystal clear, but am I explaining that?
Yeah, I think so. Okay. If anyone could comment with questions, if anyone,
that would be great.
Yeah, but I mean, how I understood that was, it's not that we're making up the pain, which obviously would be offensive to someone because someone has real pain and they're like, acknowledge this.
Yes, thank you for that. Yes.
Right. But it's, it's more of because it is in your head, because your brain is responsible for really sending those pain signals, right? Yes. Is that kind of what
that's exactly what I'm saying. Thank you very much, Christina. Yes. And it's not at all that you're making it up, that you're hysterical, or I don't know, it's like, it has nothing to do with that. And I think people have heard of phantom limb pain, where, and often we hear about this associated with like the military, because people, can lose a limb and still have pain in that limb. And they're not making that up. Like your brain is sensing pain from a part that's not even there anymore. So that's like a really extreme example of, it's not necessarily structural, right? All you need is a brain to sense pain. You don't even need the body part.
Yeah, but so interesting.
It's no less real, than the kind of pain you have when you burn your finger on the stove or whatever. Like that's an immediate, that's real. You're not making that up. And the other pain is the same way.
Yeah. Yeah, very, very, very interesting. I've always been curious why that is, why we have phantom limb. Yeah,
Yeah.
looks like we have a comment from Emily Ann Kinlaw here. So yeah, brain is responsible for feeling pain. Makes sense. Cool. So we
Yeah.
got that message across. Great. So yeah, why do you think it's important for people to pay attention to both mental health and chronic pain, especially right now?
Especially right now, yeah. Always important, but especially right now because I think it's easy right now to start to focus on things that scare us, things that cause us stress. There's just so much of that out there right now. You know, your job, your health, your loved one's health. Should you go to their, all of those questions are pretty stress inducing, right? And so if we go there and stay there, if we keep thinking about that kind of thing all day long, that's going to help to wire our brains to go there more easily.
Mm.
So whatever you think about and focus on changes your brain, actually changes the physical structure and the chemical makeup of your brain. So, a thought is actually a thing physically happening in your brain, making those connections. So paying attention to your thoughts is really important because, of course, you're going to have some thoughts of worry. You're gonna have those thoughts, and it's good to acknowledge those, not to try to suppress them or pretend, oh no, I'm really happy, but to acknowledge those and then see what you can focus on that brings you joy, or that use your senses. Focus on the beautiful flowers and the hummingbirds outside, right? And cooking something wonderful, like smell is a really good, it goes directly, it's like 2 synapses away from the brain or something.
Yeah.
Yeah, is that right?
It's
So
like I think it's the closest direct nerve, and so if someone
yeah,
watching is, correct me if I'm wrong, but it's the first nerve to go with any kind of neurological decline. So is the olfactory nerve, which is your smell. So
yeah,
I believe it's one of the closest, in direct nerve.
yeah, great. So anyway, yeah, that's a good way to not distract yourself from your worry, but just more to become present. Because it's not that the worry is real and the other stuff isn't. Usually the things we're worried about haven't actually happened yet. It's not real. But the wonderful meal that you're making, that's real. You could smell that and see that and enjoy it. So so very important, because we want to stay away from that inflammatory chemistry and that brain wiring that can really create a super highway to those thoughts of stress and worry, can make it easier to go there the more you do it. So so steering yourself away from that, thinking about whatever makes you happy, really important during this time for both physical, mental health, chronic pain, the whole deal.
Yeah, absolutely. I can think of a handful of patients that are, just in a world of pain, and they've had this issue for so long, and it's really hard for them to see past that pain.
Yeah.
And so, the idea of putting your focus on something else is such an important tool, but something that I definitely feel like people need to be guided on how to do.
Yes.
Because, it can be like easier said than done.
Yeah.
So, but yeah, I love all those tips that you just said and things that you brought up. And we have a relevant question down here. So Emma Castillo says, can isolation from quarantine cause or increase stress? Sounds like you kind of answered that just now, worry not being good.
Definitely. And I think the isolation in particular, because we just don't have as many things to focus on generally, right? So maybe you'd be out there in the world, you'd be engaged, you'd be at your office, you'd be talking to other people. So you just kind of have to be more present. But in isolation, man, those thoughts can really run away with you. And they can, definitely go to stress or worry pretty easily. if we're not really conscious of, focusing on things like gratitude. A gratitude journal is a good place to go. Remind yourself that there are things that you're grateful for. There are things that are going well. So we're talking about the chemistry. So we know about the inflammatory chemistry that stress, anger, worry, those kinds of emotions cause. And the opposite is also true. So that feel-good chemistry that happens when you're petting your dog, when you're talking to a good friend and you're laughing together. Laughter is so good for the immune system, it turns out. Now there's research about this. So trying to steer it the other way. But yes, definitely quarantine, isolation, not good stress-wise, right?
I believe it's, is it the Rosetto study? Have you heard of that? So
I'm not sure.
It looked at it was a community, I believe it was in, oh gosh, I don't want to get
Rosetto?
Is that, yeah, maybe. I think it might have been the person that was doing the study too. But anyways, they did this study on looking at the association between community, basically the benefit and the health benefits of having a sense of community when this certain population actually didn't really eat a great diet. They kind of ate, a standard American diet, which, we'll go into maybe later.
Terrible.
We know it's not good for us. And so, they had all these things against them. Like they didn't really eat a great diet. Maybe they drank alcohol, whatever. But they had one of the lowest numbers or risks of chronic disease. So just because of this community aspect. So it's so important. And I'm really glad that we brought that up. And then I see another question down here. What's the connection between your gut and mental health? So that's a wonderful question. I will actually kind of go over that. And that's from my brother, John Stapke. Thanks, John. He's in California. But I will go over that during my section of the interview. And then let's see here. So why is it important, I just asked that question. What can be done to actually reduce or eliminate chronic pain?
Yes. So there, I see my half hour is just about up. So I'm going to point you to the website, mindingyourpain.com. We have a lot of great resources there. It's just a bunch of links really right now because we don't have our webinar up and running. So we have a bunch of good links to books, to videos, to articles that you can read about this. But just briefly, calming the nervous system, very important. And, different techniques for doing that, breathing techniques, kinds of meditations and things like that can be helpful. Working with thoughts and emotions is really important. Also, directing your focus. So if you're focused on that pain, if you're keeping a pain diary, for example, when am I am I detecting pain now? Oh yeah, there it is. That's actually going to help your brain learn to sense that pain more easily, and is going to, help you to feel the chronic pain, which is not what you want. So directing your focus away from that is actually helpful. So keeping yourself safe, go to your doctor, all those things, but try not to focus on the pain. Am I feeling it? That kind of thing. Getting more active can be really important. Focusing, on what makes you happy, getting that feel-good neurochemistry going. The class that we're doing is actually designed so that you come away with a personal plan. So you will have a plan when you finish of specific things that you can do to help to reduce or eliminate your chronic pain. And a lot of it will be kind of in these categories.
Yeah, awesome. I love all those tips, kind of being aware of, what you are grateful for, not, trying to track down when your pain's going to come up.
Yeah.
Meditating, breathing, all those things can be so helpful. So
yeah. And I think that remembering that because all pain is perceived in the brain, then everything else that you do with your brain, so all of your thoughts and emotions, where you're directing your focus, those can all kind of dial the pain up or down. So they can make it worse, or they can help it out. So
yeah, awesome. I just want to keep up to date with our comments over here so no one gets left out. So Lucy Pogues, it's interesting that you mentioned how smells in the brain are connected, because I try and use my essential oils to help facilitate the mood I'm looking to achieve, which is so, awesome.
Yeah.
A little lavender and a bubble bath or something to get.
Yeah, nice. Sounds great.
Cool. And Emily Ann Rosetto, thank you. Thank you for that clarification.
Thank you, Emily Ann.
Yeah. Okay. So what do you think the biggest mistakes people are the biggest mistakes people make with trying to reduce or eliminate chronic pain?
Probably, just losing hope, as we talked about, continuing to look for a structural cause, even after you've been to several doctors and, you can't really find anything. That probably is a mistake. Opioids, they're really not helpful for chronic pain. They can cause all kinds of issues. I mean, we know about the addictive element. That's a big thing now. But they can also cause depression, hormonal issues, disrupted sleep, and none of this is good for pain. And also, ironically, it's possible for them to cause a greater sensitivity to pain. So anyway, but just, have hope. There's a lot that you can do with the depression and anxiety that often come with chronic pain, and the chronic pain itself.
Yeah, good to know. The fact that they may sensitize you to pain is mind-blowing, and something that I feel everyone should know, before, and totally something that can be really helpful temporarily until you figure out maybe a different plan. But
definitely,
the fact that you can be more sensitive to pain is very interesting.
Yeah, so, and for acute pain, like that broken ankle we were talking about, they can be, of course, really helpful. But long-term, they just cause all kinds of problems.
Yeah. So why do you think these kinds of approaches aren't more well-known?
Yeah. There's kind of this gap between psychology and medicine, right? It's like you have psychiatrists and psychologists who do psychological testing. They do therapy, and psychiatrists prescribe psychoactive drugs. Then you have medical. So that's diagnostic testing, lots of that, great testing, drugs, surgery, physical therapy possibly. So all that can be really helpful, of course. But there's also this gray area, this middle chasm where things get lost, including this kind of chronic pain, because it has to do with brain wiring, which really, it has to do with the brain. That's physical. That's an organ that would be in the medical. We have neurologists, but it also, a lot of this you can only do yourself with methods that are more along the lines of something that you would work with a psychologist or a psychotherapist on. So I think it's just that, it's not really a field. There are a lot of doctors out there studying this now that I've found, which is great. And we, mindinyourpain.com, you'll be able to find a list of books and everything. So you can read a lot more about it. It is out there. And I think it's starting to make it into medical schools, but it hasn't been. There's this statistic, it takes like 17 or 18 years or something for new discoveries to make it into medical school. And that's a long time for somebody who's in pain now, right?
Yeah.
So, Yeah. So anyway, those are a couple of reasons. There's also really no money in it. You know, there. I mean, you hate to talk about that aspect, right? But drugs. Let's face it. Drug companies make a lot of money, and
Especially
surgery.
opioids.
Yeah.
Yeah.
Right. They're killing it. So the opiates and then the drugs that help you get off the opiates, you know, they got it going on both sides. And yeah, surgery. So now we see hospitals are having a lot of trouble financially because they're not doing the elective surgeries that they've been doing. So there's a big financial incentive there also. And not to say that the doctors who are doing those surgeries don't mean well. I know they do. But there's the financial incentive. And with this stuff, there really isn't one, because it's things that you do yourself from the inside, and nobody else can do those for you.
Yeah, absolutely. And, you know, when the day that the neurologist and maybe the GI doctor and the psychiatrist all get in the same room and talk and, you know, work together is going to be the day for all of medicine and me. And so, you know, getting everyone working together is huge. And right now there totally is that gap. And I see that as well. So I would love for our audience to like, comment, share if any of this so far has been interesting or relevant to you, and something that you want to share with others. And also, you know, we're still taking questions. And then, so what's your advice for people listening in right now who are having a hard time with stress and the social isolation that we were speaking of with COVID-19?
Yeah. So working with those thoughts and emotions, I think is really so important. Acknowledging your feelings. There's this kind of name it to tame it idea where naming your feelings is actually helpful. There's MRI, fMRI, I guess, like it's when the brain is actually, you can see the brain moving, not moving, but you can see the what's happening in the brain. And naming the emotions you're having kind of helps to calm your system down. So that's one thing. So not denying what you're feeling, but also not getting stuck there. So kind of working with those thoughts and emotions, seeing if you can change your thoughts into a more happy, positive direction after you've acknowledged, you know, what you're feeling. Doing things that make you happy, you know, having fun, taking that seriously, you know, take laughter seriously because it's really good for you. You know, watch a funny movie, call a friend who you know is going to make you laugh. Like those things are so good for your immune system, for your mental health, for your chronic pain, for the whole thing. And yeah, I mean, if you want more support, call your local mental health counselor, you know, see if you can get a hold of somebody if you want to do that. And there are also lots of good books out there, lots of good articles on there. If you look online, some of the apps are really helpful, you know, like the Calm app, all kinds of great meditations for calming the nervous system. So those are a few things.
Awesome. I'm sure our listeners are definitely going to really appreciate those. Yeah, two other ones that I like are Art of Living. That's a good meditation app, and Headspace for anyone who hasn't heard of that one yet. So yeah, I mean, speaking of finding support, how can we find out more about you?
So you can feel free to email me. It's rozandocounseling@gmail.com. You can call or text to 206-319-5220. And we can discuss your situation and how I might be able to help you. Also, my website, rozandocounseling.com, has just a link. You can click on a button there to set up a 25-minute consultation. And you can call me for that too. I mean, you can text, whatever. But those are free. And that's just to talk about what's going on with you and whether or not we might be a good fit, and maybe I'll have somebody else that would be a better fit that I can recommend. So,
yeah, awesome. Just so to make sure I got your number right. 206-319.
Yes.
3220.
319-5220.
Oh, so close. Okay. 5220.
Yeah.
All right. So I just put that in the comments for everyone. We see it. So I have a question from Jennifer Stapke, who is my mom. Hi, Mom. What is the best comfort food we can eat during this pandemic besides organic Chardonnay?
Oh, good question.
That's a great question. So I'm going to come back to that because I'm kind of going to talk about that a little bit in a minute, because we're going to kind of switch around, and Roz is going to interview me for a little bit.
Yeah. Okay, so Christina and I met, as she said, online. And I was really excited to get to know her a little better and get to know about what she does. Because she is, I want to get this right. She practices integrative and functional medical nutrition therapy. And yes, but it's so cool because it's functional medicine, tries to get to the root of what's going on and not just suppress or alleviate symptoms, right? Mm-hmm. So, and Christina, another thing that I just think is so cool about what you do, Christina, is that you started your private practice so that you can spend the time that you need with people to really figure out what's going on for them and, really work with them in a way that's going to be helpful, which, we know you can't do always in a 10 or 15 minute doctor visit or even half an hour. So, and Christina is just a lovely, very fun person to work with. And I just really appreciate you reaching out. So looking forward to learning more.
Awesome.
So can you tell us a little bit about your practice and what you do?
Yeah. Thanks so much for that introduction. So I have a virtual nutrition counseling practice based in Seattle. However, because it is virtual, I do have the flexibility to see most people throughout the US with an internet connection, of course. So like Roz said, so my focus is to kind of shorten it, it's integrative and functional nutrition, which seems like a mouthful, but it really just means that I am trying to investigate the underlying causes of whatever you might be dealing with. So instead of just looking at nutrition and maybe some exercise, which is initially how I was trained, which is incredibly valuable and can really get people very far. In addition to that, I focus on gut health, sleep, stress, toxin exposure, environmental factors, even genetic and genomic factors, because we know all of those different components can really, really make a huge difference on how we're feeling, how our bodies are able to defend themselves against viruses or bacterial infections or whatever. So immune supports. But also we know that all of these factors can prevent or either contribute or prevent disease or illness. So I support people from anywhere with any kind of chronic condition like diabetes or heart disease or something like irritable bowel syndrome, just to people that just aren't feeling their best. So whether it be, fatigue, not sleeping well, digestion's a little off, but nothing's been diagnosed, and generally just don't feel their best. That's kind of who I like supporting.
Mm-hmm. So that sounds great. So someone could come to you, even if it's like they're feeling sluggish, they're feeling tired, they can't really find a reason for it. Would that person come to you?
Yeah, absolutely. And unfortunately, most of the time that diagnosis doesn't really, or sometimes maybe a medication is recommended, or something's being prescribed or recommended to help with symptoms, but the root cause isn't being investigated.
Right.
So those are all just signs like not feeling great, low energy, stuff like that. That's all just signs that your body might be out of balance and could just kind of use a little tuning up.
That sounds great. So really spending the time to get to the bottom of what's going on there. Yeah. So what got you into this, and what made you decide to focus on integrative and functional nutrition and gut health?
Yeah, so it started a while back. I was in college, and a family member of mine, he was struggling with alcoholism. And so he was actually admitted to a rehab facility. And I ended up meeting the staff nutritionist there. And I thought it was kind of a cool gig. So I wanted to kind of talk to him and kind of know how we got into it. And he sat me down and said, I'm developing anti-inflammatory meal plans for all the residents here. And I thought, wow, that's really cool and interesting. And what the heck does that have to do with, a brain issue, whether, a mood condition or addiction, all these things that some of these residents were struggling with. And he said, you should really look into functional medicine, nutrition. It's looking at the underlying cause of disease and illness rather than using a Band-Aid approach. And so it was kind of at that moment that it kind of clicked for me. I said to myself, okay, this makes a lot of sense why, I'm dealing with some fatigue and digestive issues and hormonal things. And, that can't be optimal. I think I was maybe 19 at the time. That didn't seem like something that I wanted to be experiencing or needed to be experiencing. So I figured, okay, if there's answers potentially for this family member, maybe there's answers for me, and maybe this is something that I can maybe help other people with in the future. So I kind of dove into my studies in nutrition at UC Davis, and I thought it was pretty funny because I at the time, and I kind of said I had digestive issues, but I guess I didn't really understand that wasn't normal at that time. So I was sitting down in one of my nutrition classes, learning about, normal digestion and, and thinking to myself, wow, I have never had normal digestion in my entire life. And, what's going on there? That's obviously not optimal. So how can I fix this? And so, later on, I kind of just, I decided to open my practice after working in a hospital and clinic, which I still work in part-time now, but really to, like you said before, kind of spend the time that I feel is needed to really help people make progress. So I have an 1.5 hour initial appointment, an hour follow-up, which might seem like a lot for some people, but it kind of gives us the time and space to just investigate and kind of do a deep dive into what's going on.
Yeah. Wow, that's great. I love your personal story, and that you got into it because of that, because of your family member, and also because of your own, issues that you were having. So how are you feeling now?
Good. Yeah, great question. Work in progress, honestly, always trying to feel a little bit better and improve, but after, and I guess I didn't bring this up, but I ended up finding a couple of functional medicine doctors that really, really helped me understand why I was feeling the way I was feeling, and actually identified a lot of underlying causes for my symptoms. And so it was refreshing and exciting, because I was like, I didn't think I was making this up. I wasn't feeling well. Yeah. So it was really refreshing to get some answers. So yeah, definitely much better than I was, when this all started.
Yeah, that's great. And through your experience seeing clients over the years, what have you noticed are the biggest struggles with people experiencing irritable bowel syndrome, irritable bowel disease, and SIBO?
Yeah. And so I think probably one of the biggest things that I have people complain of when they first come in is being confused and being anxious around what they're eating and what's going to, set their symptoms off, and feeling like they are really controlled by their symptoms. So because a lot of people will come in and say, Christina, I'm eating a healthy diet, I'm exercising, I feel like I'm doing everything right, but I still have these really severe digestive symptoms. Yeah. What's the reason for this? And then, feeling like they're controlled by their symptoms, constant confusion and anxiety over what they can and can't eat, and then also not being able to feel present. So, one patient I can think of was in her 70s when she was really struggling with some severe digestive symptoms, SIBO in particular, which for those of you who don't know is small intestinal bacterial overgrowth. It's something, a digestive condition. But for her, I mean, she was in her 70s. She really wanted to be present with her grandkids and her husband. And that's not to say that everyone shouldn't be granted the opportunity to be present with their loved ones and,
Right.
the people they care about. But, it was just kind of taking away from her life. So those are the biggest complaints that I get.
Yeah. Yeah. And I understand how digestive issues, things like that, they really can run your life. And it sounds horrible to always worry about what you're eating, and is that going to set you off?
Exactly.
Yeah.
Because you're not going to get away from your digestion every day. Every day we have to think about how to eat, unless someone's fasting for a long period of time, which is not recommended in my book.
Yeah.
You're always going to have to eat, and you're always going to have to digest things. That's how we thrive and get our nutrients. So it's not something we can really get away from.
Can't stay away from it. Yeah, good point. And what would you say are the biggest misconceptions about these gut conditions and other chronic illnesses and conditions?
Yeah, I think probably one of the biggest misconceptions is the fact that there maybe aren't any answers, or that someone has to kind of deal with this for the rest of their lives in the severity that they're currently experiencing. Now, I do want to say that there absolutely is a subset of people that will have to deal with their symptoms for the rest of their lives.
Okay.
However, I don't think they have to maybe experience them to that degree.
Okay.
And, there's always ways that we can try and reduce inflammation and correct underlying imbalances and gut bacteria and, all of these other things that we can do to support your gut. And, a lot of people are told that whether maybe it's IBS, that commonly is someone's prescribed something to either help their diarrhea or constipation. And, they're not really told that there might be other reasons for this that we can actually identify and then take care of.
Okay. So they're prescribed something to kind of get rid of the symptoms maybe, but they're not getting to the underlying cause?
Exactly. Yeah.
Yeah.
And there's a lot of ways that we can kind of identify that. One, that underlying cause. So one is gut microbiome or gut bacteria testing, which give us some clues into what's going on there. Or sometimes people are sensitive to different foods. Doing that kind of testing to eliminate that kind of source of inflammation. Those are kind of two examples of things we can do to identify why they're having those symptoms.
And why would you say it's important to keep our digestive tracts really healthy?
Yeah, so
keep them that way, or help them to get that way.
Yeah, so this kind of ties into John's question back here on the mental health and the gut health connection. And so first I'll just answer that one. So we know that I believe one of the only direct nerves, maybe besides olfactory, someone who is a neurologist or doctor on here, fact check me here, but we know that our vagus nerve is connected from our brain stems, which is the bottom of our brain, all the way through our entire spine, throughout our body. It's like fingers throughout our gut and our entire body. So we know that, if we're feeling stressed or anxious, our gut bacteria can actually notice that and can change as a result. If, we're chronically stressed, like during this pandemic. And then unfortunately, the other side of that, and, there's a lot of important things that have to do with the gut. But another thing is over 70% of our immune system is associated with the GI tract. So that's pretty mind-blowing, right? So if we don't have a gut that's in good shape, all of our bacteria are happy, in a good, diverse community, working together, no bad bugs out of balance, then our immune systems can actually suffer. So people, with some kind of gut issue, and believe it or not, some gut issues or imbalance of good and bad bacteria can actually, be silent, or people don't have symptoms.
Okay.
So really taking care of our gut is really important in supporting our immune system. And so outside of that, we have connected nearly every chronic condition, or many of the more prevalent ones, especially in the US, to the health of our gut and our gut bacteria. So yeah, very important for everything.
Very important. So you said over 70% of our immune system resides in the gut.
Is associated with the GI tract.
Associated with the GI tract. Yeah. Wow. That's pretty. That's a big deal. And I've heard it called the gut brain. I guess I've also heard that there are more neurotransmitters in the gut than there are in the brain.
Yes.
Is that
so
true?
The vagus nerve is just one part of it. We actually make, I believe, more serotonin. I think it's 500 times or something, like a crazy number, way more serotonin in our gut for our gut bacteria to use than we do in our brain.
Yeah, really interesting, huh? And so what do you think are the biggest mistakes people make with diet changes? I know people try to do that on their own to help their digestive symptoms. What are the mistakes there?
Yeah, so I have a lot of clients come in that have been on a really restrictive diet forever because, maybe they did some research online because, they were struggling and suffering and they wanted answers. So I definitely don't ever blame them for that.
Yeah.
But staying on a restrictive diet forever, because that can actually change your gut bacteria. So we talked about that kind of composition of the good and bad bacteria in your gut. It can change that and actually do more harm than good.
Yeah. Interesting. So diversity too.
So that, and sorry, I forgot
good
to
even
mention.
In the gut.
Huh?
I said diversity is good even in the gut, right?
Yes, exactly. So the other reason is, yes, restrictive diets can do harm to the gut bacteria, but also just going on a restrictive diet isn't true. Maybe it can give us clues as to what's going on, but it doesn't actually tell us, what is actually causing all this. Let's figure this out. So when you go off that restrictive diet, you can actually feel better, and not have to keep going on and off and have this kind of roller coaster. So
yeah, I think that's a really good point. So the restrictive diet, I think there's a lot of information out there that, if you're having gut issues, try this diet, try that diet, try the FODMAP, try the whatever. Yeah. And so what about during the pandemic? Is there anything specific that you can think of that would help people during this stressful time?
Yeah, so I have a few tips that I've been telling a lot of my patients nowadays. And the first thing that I would offer to everyone is to myself included, let's all choose to be a little bit more gentle on ourselves. And, whether you gain a couple pounds or, you haven't been as diligent working or, whatever you feel like you're struggling with right now. We're all experiencing some level of trauma right now. I mean, maybe you can validate that. This is a kind of a crazy experience. And so we're all kind of just figuring out ways to cope and ways to get through this. So so acknowledging that maybe, okay, this is an issue, this is something that's happening, and that's okay. And maybe moving forward and choosing, okay, how can I make a conscious decision to support my mind and body? I'll kind of go into that a little bit. So number 2, if you feel like you are falling off track, or, whether it be with health goals or whatever, work or whatever you're struggling with, get support from people that will hold you accountable, or people that will kind of help keep you on track. So this could be, a friend, a family member, any kind of loved one, or a practitioner, like a dietitian or a counselor, just someone to kind of guide you through this time. And then 3, so I usually recommend aiming for the 80-20 guideline for most people. So that means, and this kind of answers my mom, Jennifer's question down here, comfort food during this pandemic. So 80% of the time choosing whole, real, unprocessed foods. So essentially, if you can imagine it, in nature, it can be considered, real whole food.
So the organic Chardonnay, then that would fit into that category.
Yeah. So that would probably fall into like the 20%.
Okay.
Right.
Yeah.
So, 20% of the time indulging in things that, and don't get me wrong, organic, I would recommend that more than regular, but 20% of the time indulging in things that might not be the most nutritious, but it's something that you enjoy and you want to keep in your life. And, people can do this intuitively on their own. If things are out of balance, sometimes having kind of that guideline can be really helpful in kind of understanding what that looks like for balance. So, for example, for me, I don't count how many times I eat ice cream during the week, but, every 2 of 10 meals, I'll have ice cream or something sweet because I love sweet things like ice cream. And I feel like I can still maintain, a healthy diet and feel good if I maintain that balance. So that's kind of one example. And then lastly, move your body in a way that's gentle and restorative and feels good to you. Prioritize sleep and do something fun. A lot of us are kind of, me included, maybe aren't able to do the things that we love to do so much all the time. So kind of just finding things that are fun to you to kind of, because it really, it's not only enjoyable to you, but like we talked about, it can really, really help reduce inflammation, support your immune system. Just having those, positive chemicals flowing is really, really helpful. So.
Yes. Yeah, that's great. So that's great to hear that you're not saying, cut out the dill pickle potato chips. Those are so good. Or don't cut out the ice cream. It's okay. It's good to have it, but 20%.
Yeah. And I will say, sugar can really dampen your immune system. And so definitely not all the time, and kind of finding balance there for sure.
Yeah. Yeah. And Emily Ann Knoll Kinlaw has a comment: important not to restrict foods or label as good or bad, right? Mental health matters and something. But
yeah, it looks like it got cut off there.
Yeah.
So yeah, definitely, listen to your body. That's kind of where that intuitive eating comes into play, which is honoring what your body is really needing in that moment. And really just thinking, okay, how can I support my body most of the time with things that feel good, that taste good, and then, the other half of the time, or other 20% of the time, what's something that I just really want right now that sounds great, and maybe not have it be all the time. But if you want that, maybe you can kind of see, okay, how does this feel? How does it feel to eat ice cream for every meal, every day? Might feel great. For me, I know it definitely wouldn't. So kind of just honoring the symptoms and signs that your body's telling you. But definitely so important. Mental health is definitely paramount during this time.
Yeah, that's great. So as Emily Ann says, not labeling it bad, just seeing how it feels to you, and if you're going to have it, just go for it. Really enjoy it.
Yeah, definitely.
Yeah, great. So what can be done to figure out gut conditions or chronic diseases or illnesses? How do you get those figured out?
Yeah, and so this is kind of what I do, but this is what I'd recommend looking for in a practitioner if you need to have something solved on your own. So first, we want to just identify all those contributing factors that might be just feeding into whatever you're experiencing. So we're looking at diet, we're looking at exercise, sleep, stress, toxin exposure, gut health, relationships, genomic factors, genetic factors, and then having someone that really spends that time. So again, like I know a lot of functional medicine practitioners that have at least an hour and a half initial appointment, because we're really trying to understand what happened from, when you were born to where you are now, to see what all fed into how you're feeling now. So hour and a half initial, hour follow-up, and then making a plan moving forward that feels doable to you. So, I could have someone sit down and I could tell them to do, eat this way, sleep this way, do all these things that might be really lofty goals. And, that's not helping anyone. So having someone that kind of sets really small attainable goals to make change easy. So make, eating a little bit more whole foods. And when I say whole foods, I mean, unprocessed foods. Doing that in an easy way, moving in a way that is enjoyable to you. So setting small goals to kind of focus on all these different areas to not make it feel scary, but very doable. And and so maybe adding, like I said, diet and lifestyle tweaks, and then, potentially high quality supplements if needed to kind of give your body the support it needs.
Yeah, that sounds great. So how can our audience learn more about you and what you have to offer?
Yeah, and so I posted the link in the comment section to have a free discovery call if that's something you're interested in. Also, my website, ChristinaStapke, RDN.com. I'm also on, like you all know, Facebook, which we're broadcasting this from, Instagram, Pinterest for yummy recipes if that's something you're interested in. And then you can always just PM me if you have a question right now as well. And so I want to check and see if I answered all these questions. I think I did. So so from Lucy, so what are steps you would recommend to someone who's starting their gut health journey, and how do you keep the motivation? Yeah, so I think really just, again, finding someone that can guide you through that process to identify. Because again, I could say just go on this diet and you might feel better. However, that's not helping us in figuring out what's going on underneath that. So finding a practitioner that understands functional medicine and nutrition and understands that all these different components can really contribute to how you're feeling, and keeping the motivation. Yeah, I mean, same goes for that. Having someone to hold you accountable. Another helpful thing is getting someone to kind of, if you know someone, a friend or family member that's struggling with a similar issue, getting them on board, getting people that you care about and that you're around, aware of kind of the changes that you want to make. Can be really helpful in kind of sticking with it. And also just knowing, there is an end in sight and there are answers, most of the time at least. Yeah.
That sounds great. I mean, I feel like if I came to you, you would really work with me to try to get to the bottom of the, so to speak, of the gut issues and and what's going on. And then it seems like I would also come away with a plan that was actually doable for me. So you're not going to give me some really complex restrictive diet that I'd take the paper and go, okay, great, and file it away when I got home and probably never do it. It sounds like it's going to be working together with your client to find out what are they willing to do, what's going to work for them.
Yeah, absolutely.
Yeah.
Nice. And so, so if anyone has any other questions, we're going to wrap up here, but thank you so much everyone for your engagement. This was an awesome group with a lot of good questions.
Thank you for that. That was great.
Yeah, let me just double check on this. And if we don't have any questions that we missed. Yeah, it looks like we're good. So again, thank you all for tuning in with us. And we all wish you well during this time. We might not be out of the woods yet, but let's just continue to support each other and take care of ourselves. And thanks so much for being here with us.
Yeah, thank you. Take good care of yourselves and be kind to yourselves during this time.
All right. Take care, everyone. Bye.
Bye.